Why is voluntary control of urination important for bladder health? Imagine being able to decide when and where you go to the bathroom. That's what voluntary control of urination is all about. It might seem simple, but it plays a vital role in keeping your bladder healthy. Your bladder is a muscular organ that stores urine until you're ready to release it. As it fills, stretch receptors in its walls send signals to your brain, giving you the sensation that you need to urinate. Your brain, especially the part called the micturition inhibitory center in the frontal lobe, then decides if it's the right time and place to go. When you choose to urinate, your brain sends signals to relax the muscles around your urethra and tighten the bladder muscles, allowing urine to flow out smoothly. Having control over this process is important for several reasons. First, it helps prevent your bladder from overfilling. If you ignore the urge to urinate repeatedly, your bladder can stretch too much and become weak. A stretched or weakened bladder might not empty completely, which can lead to infections or even bladder stones. Second, voluntary control helps avoid urinary retention, where urine stays in the bladder because you cannot or do not want to empty it. Stagnant urine can become a breeding ground for bacteria, increasing the risk of infections that might damage the bladder lining or cause inflammation. Chronic inflammation is a concern because it can be a risk factor for bladder cancer in rare cases. Control over urination also supports continence, meaning you can hold urine until it's socially appropriate to go. This prevents involuntary leaks that can cause skin irritation, infections, and emotional distress. For people with bladder issues or recovering from bladder cancer treatments, maintaining continence is especially important. Additionally, voluntary control is the foundation for bladder training, a behavioral therapy that helps people who experience urgency or frequent urination. Through bladder training, individuals learn to hold urine longer and reduce urgency, which improves bladder function and quality of life. Another key point is that complete bladder emptying is crucial for health. If the bladder isn't fully emptied, residual urine remains, raising the risk of infections and irritation. Chronic irritation can cause inflammation, which has been linked to a higher risk of bladder cancer. So, being able to control when and how you urinate helps keep your bladder functioning properly and reduces potential health risks. Practicing good habits like responding promptly to the urge to urinate, avoiding holding urine for too long, and staying well hydrated supports bladder health. Lifestyle choices such as avoiding bladder irritants like tobacco and certain foods, and doing pelvic floor exercises also help maintain control and prevent problems. However, some conditions like nerve damage, prostate issues, or side effects from certain treatments can impair this control. In those cases, medical evaluation and management are essential. In summary, voluntary control of urination is a cornerstone of bladder health because it helps prevent overfilling, infections, and retention. It supports continence, aids in bladder training, and reduces the risk of irritation and potential cancer development. If you notice any changes in your urinary control, it is important to consult a healthcare professional for personalized advice. Maintaining this control is a key part of keeping your bladder functioning well and your overall health in check.